Today we will be showing you how to administer heliox. Helium is an odorless, tasteless, non-explosive gas and is used in airway obstruction to lift up and make it easier to expectorate. Since helium doesn't sustain life, you must mix it with at least 20% oxygen. The mixture together is what we call heliox. Commercially prepared cylinders of helium-oxygen mixtures are available in 80-20% and 70-30%. You will be able to tell your cylinder is heliox by the color of the tank, green for oxygen and brown for helium. Just make sure you check the label to know you're administering the correct gas mixture. Heliox is administered through only approved devices via non-rebreather. Due to heliox's properties, when the gases sit, they'll separate due to the different densities of the gases. When administering this gas, make sure you're testing it at the patient's site to make sure the gas is adequate. If you cannot provide adequate flow through the non-rebreather, a nasal cannula can be placed under the non-rebreather mask to allow the patient to receive more flow. Heliox helps people with certain lung conditions such as acute asthma breathe easier. Some studies suggest heliox may also help emergency treatment for chronic obstructive pulmonary disease, or COPD, by reducing the length of time patients have to stay in the hospital after an episode of severe or exacerbated symptoms. When using heliox, because of the calibrations of the Thorpe tube flow meter depending on the gas properties, we must do a quick calculation when using this different gas. For an 80-20 mixture, in order to find the correct flow, you would divide the desired flow rate by 1.8. For a 70-30 mixture, to find the flow, there's a different factor, but we use the same calculation. Divide the desired flow rate, but this time by 1.6. Heliox may be included in your COPD treatment if you also have asthma or an airway obstruction and need emergency care, you have severe COPD symptoms, or you have end-stage COPD and receive heliox for palliative care, just to make you more comfortable. And that is our administration of heliox.